Hi everybody. So the topic for today's reel is surgeries for prolapse. And surgeries for prolapse is a topic which is a little complex, so I will try to simplify it. The first thing you need to see is the age of the patient. Now if the patient, we start with the very older age group. So if the question comes that the patient is of the older age group, and by older I mean if she is unfit for major surgery. For example, if an 80-year-old woman is given, or an 85-year-old woman is given who has multiple comorbid conditions and isn't fit for surgery, then what do? Then the best thing for her would be either to put in a pessary. Commonly used pessary is a ring pessary, or you can do a colpoclysis, which is called a Lee-Ford colpoclysis, where you close off the vagina, and this is a relatively much shorter procedure. It can be done under local anesthesia also. The second and more common age group where we find questions related to prolapse is the perimenopausal, postmenopausal age group. And here, if the woman comes with prolapse, it depends on what type of prolapse is it. If it is a cystocele, you'll do an anterior colporrhaphy. If it is a rectocele, you'll do a posterior colporrhaphy. And if the uterus has descended down, you'll do a vaginal hysterectomy. Now, commonly, these three things happen together. So what do? You do a Ward-Mayo's repair, which is a vaginal hysterectomy plus an anterior colporrhaphy plus a posterior colpoperineophraphy. The third age group of patient is that age group where they are not very young and their family is complete, but they're not peri or postmenopausal either. So this would be the question would come like a 30-year-old woman with 2 children, family complete, but has a uterine prolapse. What do you do in this patient where her family is complete but she's too young to undergo a hysterectomy? In this group of patient, we do what is called a Manchester repair or a Fothergill's repair. What do we do here? Here we do 3 things. We do a cervical amputation, we do a plication of the Macken-Rod ligaments to the cervix, and we do an anterior colporrhaphy and a posterior colporrhaphy depending on if the cystocele or rectocele is there. And the last group, the fourth group of patient, is the young nulliparous prolapse. Now this is rare. It's usually because of congenital weakness of the pelvic floor. But if you do see a woman or a girl, young girl with prolapse who is not married or hasn't had children yet, here you want to conserve the uterus entirely. So here what will you do? Here you will do what were earlier called as sling surgeries. Now we call them as hysteropexies. So hysteropexy means lifting the uterus and anchoring it to a fixed point, and one of the commonest ones is a sacrohysteropexy, which was earlier called as Schrodker's sling surgery. So this is how you manage uterine prolapse in different age groups.